Nearly 5 million teens in the U.S. ages 12 to 17 had at least one major depressive episode in 2021, and that's according to research from the National Institute of Mental Health. Medication is a common tool used to treat depression. As ABC's Juju Chang reports, some teens are taking ketamine now to treat severe depression.
The powerful anesthetic ketamine, now being used to treat some teens with severe depression.
Everything revolved around being scared and being skinny.
18-year-old Brenna started ketamine 5 years ago after experiencing mental health difficulties, including anorexia, depression, and suicidal thoughts that were exacerbated by the pandemic.
I had tried the usual SSRI antidepressants, and I had been in residential treatment, inpatient treatment for months and months and months, and things were just kind of getting worse.
She was really declining, and so it was an act of desperation.
Watching her suffer and waste away, her dad Lee looked into unconventional treatments and heard about ketamine for use in patients where nothing else worked.
If you want to save your kid, if you want your kid to survive, you try whatever you can.
Ketamine is used regularly as a painkiller and anesthetic, but it's now being explored in treatment-resistant depression. And under strict circumstances, doctors do prescribe it to teens off-label. Dr. Phil Wolfson treats Brenna.
We began to use very low-dose ketamine with her, which gave her respite, gave her a timeout from how she was thinking, suffering, holding on, being in control, being miserable. And that worked, and she just grew and grew.
Brenna had low-dose ketamine-assisted therapy sessions once a month to start, and her dad says her eating disorder started showing improvement after the first session.
We went to the restaurant that was next door to the clinic, and Brenna ate. She ate a meal, something that she hadn't done in a very, very long time. It was like a miracle.
But doctors warn there are limited studies in teens and no data on what ketamine may do to the brain long term.
We need more data in adults, and we certainly need more data in teens. Ketamine can cause profound sedation. It can cause dissociation. It can certainly alter your vital signs. It is not something that should ever be done without an experienced professional or not in a monitored setting.
Brenna continued to improve. Now in college, she returns for maintenance ketamine sessions every 6 months.
Since I've started ketamine, I've gained 20 pounds. All of my symptoms are very well controlled now. I no longer qualify for having anorexia or PTSD or anxiety or depression.
I am just so proud of her and love her so much.